using xenographic materials, which I have not been using in the past, and going over the logic on why we're using them. And that's just one specific material type. But then to be able to build more of horizontal and vertical bone in using different grafts and different membranes to do so, I think was presented in such a straightforward fashion that as long as you have the knowledge beforehand of what you're doing and why, now that I've seen it done, I've tried it on models, I think I should be able to do it without that much difficulty.
I definitely want to start placing the soft tissue grafts and performing GBR procedures. This is not my first time being exposed to the GBR topic and techniques. I did do a one-year continuum at Loma Linda, but Dr. Sasha has been very meticulous about explaining the topic, and again, it's the size of the class actually that helped me have confidence because of the more personal connection with the staff and just having a lot of time with the materials.
I've been to so many courses where they just strip off the bone, place implants, but it's about the numbers, it's about how many implants are you doing, or you're going fast and arches in a day and teeth in a day. I think the difference that I saw with Dr. Sasha is how he is considering that patient. If I see this patient over 20 years, what's going to happen? And that's what I want for my patients. Like if I see these patients, today I do these cases, and then I tell all my patients, I don't want to see my cases failing. Maybe my kids will treat that's fine, but I don't want to see my cases failing when I'm there. And then I think that was the big thing that I really admired about him, is that he's talking about the success rates 20 years down the line. Not like you do the case today and okay, I'll see what happens in the future. So that was a big thing. And I think that's the thing that impressed me the most about his techniques and everything that he does for it. And that's what I was looking for.
It's like a mini residency. All the knowledge was compact in 4 days. And I feel very confident for the next week, see my patients and offer advanced procedures like a guide bone regeneration, and also to teach my students. Always ask me where to go. Now I'm going to start the implant dentistry. Where should I have a proper training? We found the place.
Well, my name is David Lillian. I'm an oral surgeon. I practice in Albuquerque, New Mexico. I think originally I heard about GIDE through a referring dentist who highly recommended Dr. Jovanovic. I also saw him lecture at an osteogenics meeting a few years ago. The reason I decided to come to this course is mainly because I just kind of wanted to level up my game. I remember an old oral surgery colleague some years ago, before I finished residency, telling me that what he thought was most important for continuing education was really getting out there and seeing the periodontal soft tissue side of things for the best results in managing easy and complex implant cases. So that was my motivation, was just to kind of take my understanding that I have right now and level it up, bring it up to a different game, and just become a better clinician, make better decisions, handle the types of cases that I've been handling with a little bit more ease. I wanted to learn techniques just to make my life a little bit easier, whether that's simple suturing techniques or considerations and when to place an implant, when to delay the implant, all of those sorts of things. Yeah, this course has certainly altered the way I approach things. I think that, maybe when I first started out on my implant and grafting career, it was just, do I have enough bone to place an implant? And I'll place it where I have the bone. And then you start thinking about more restoratively driven implant placement. And now with this course, I'm kind of augmenting that and adding in the soft tissue component, which is what I'm really excited about adding to my practice, is to be able to not only provide the aesthetic results that patients expect and that I want to be able to provide, but also to be able to provide longevity for these implants. I've seen enough cases, whether they be of my own or other surgeons, where the implants are failing. And I think through this course I've started to realize I can now answer why that is happening and manage it.
So my name is Dr. Mayank Kakkad. I'm currently based in Ohio, and this is my second time coming to this event. I have attended in the past digital dentistry course, which was 2 days course back in February, and I really loved it, and that's the reason I decided to come back and do a little bit more advanced course. This time I'm doing advanced GPR, soft tissue grafting, as well as a sinus lift course. With this live surgery, hands-on and lecture, it kind of like gives you an overall very comprehensive understanding about the information that Dr. Giovanni has been sharing with us. So I've been placing implants from some time, but there's always a difference between how you can get better. When you go back to your own cases, I realized that there's so much better I could have done, and that's why I decided to do this course, but now I do feel much more comfortable. Last time when I attended a digital dentistry course, I started implementing the digital dentistry in my practice, where now everything is scanning, 3D printing, surgical guides, and more I place the implants, the more I realize the role of bone graft and soft tissue plays such an important role in long-term results. And that's where I was thinking about doing this advanced course where I can learn about these procedures. I'm surely going to learn and take this information back home and try to implement on my patients to provide the best long-term care. Obviously, I had a wonderful time. There's so much to learn. Dr. Giovanni is full of knowledge, and I just couldn't agree for every small details that he has been talking about. I also got a chance to observe him firsthand. So both the times, last time as well as this time, we saw a live patient surgery where I was able to understand his own setup, how does it work, and everything that we talked about in this course, we were able to actually see it in the first hand. So that's really made a lot of difference, because many times we are not able to really connect those dots, where we see a lot of slides, we see a lot of presentations, but we are not actually able to understand how it's going to work in a real live world.
Dr. Dan Norris, I'm from Utah. I'm a general practitioner there. I have an implant-only practice, so placing and restoring implants. Having placed implants for a long period of time, looking more so to cases that are 10, 15, 20 years old and seeing how I can improve those. And so definitely noticing that I needed to augment soft tissue much more. That I think that being at the course was one of the biggest things I learned. I also appreciate the principles of using autogenous bone with xenograft bone. I know there's a lot out there about allografts and alloplasts as well, and it's really pushed heavily from the distributor side. And so I really appreciate that. I'm going to implement that a lot more. It's much easier to, where I'm sedating a patient, it's much easier to use and harvest autogenous bone and use with xenograft bone. So, and changing over as well, I've used some implant systems in the past that you can't use with xenograft bones very well. And so now I can alter the way I do things so that I can have a better long-term result, I think. I think maintaining space, volume has always been a target trying to chase, so I'm really excited to be able to get to that point where I can maintain that space and volume better as well. I came to the course really looking for the pearls of soft tissue management, and principles of GBR that could be put into practice but repeatable as well. And I felt like delivered very well on that. I feel very confident that patients that I'll be seeing Monday morning, I'll be able to successfully manage soft tissue better, look more so to augmentation of soft tissue, and the principles that I've learned here, I feel like I can use those very easily Monday morning. So I really appreciate that. That was my main focus of coming here, and I feel like that was very much fulfilled.